In this video, we are going to discuss about superficial reflexes. So in the previous videos, we already discussed about the deep tendon reflexes. So in this video, we will discuss everything about superficial reflexes and the importance of them. So what is a superficial reflex? A superficial reflex is nothing but that is the stimulus that is given is superficial. That is what it means. So reflex responses to stimulation of either the skin or the mucous membrane. This is what is called a superficial reflex. So what kind of stimulus are we going to give? It could be either a light touch, or it could be a scratch, or it could be a stroke, even like a small stroking sensation that we give. So this is what is a superficial reflex. So how different are they from the deep tendon reflexes? So this is very important. The difference between the superficial reflexes and deep tendon reflexes based on physiological points. First thing is the superficial reflex is polysynaptic, whereas you know that deep tendon reflexes are monosynaptic. And these superficial reflexes have a very good latency period. That is, it will take some time to respond. So there will be a latency period and it is easily fatigable. So each time when you try to recreate the stimulus, you try to do it again and again, it is more fatigable. So it is not easily reproducible. And lastly, it is not as consistent as your deep tendon reflexes. It is not as consistent as deep tendon reflex. So all these are the differences between superficial reflex and deep reflex. And so what is the importance or what is the significance of the superficial reflexes? See, the combination of a exaggerated deep tendon reflex, that is a hyperreflexia, and a decreased or absent superficial reflexes is suggestive of a pyramidal tract lesion, essentially a stroke or some pathology involving the pyramidal tract, that is the corticospinal tract. And similarly, the unilateral absence of superficial abdominal reflex is an early indicator for a corticospinal tract lesion. So this again is a significance of the superficial reflexes. So now we'll discuss in detail a little bit about each of the superficial reflex that has been described. So first thing is a palmar reflex. So first thing that you have to remember is this reflex is not seen in healthy individuals. It is a release sign. It is usually abolished when the child reaches around 1 year of age, around 12 to 18 months. This reflex will be abolished. So what is a stimulus? The stimulus will be a gentle stroking across the palm of the hand, and the response will be closing of the hand, that is the finger flexion. So you know the flexion of the fingers will be mediated by median nerve and ulnar nerve. So that is the nerve responsible. So nerve that is responsible is C6 to T1, and the response is usually absent in normal individuals. So when this is exaggerated, this is what you call it as grasp reflex, and you know that it is a release sign. It is a frontal release sign. There is another reflex which is called a scapular reflex, where you scratch the skin over the scapula. You scratch the skin over the scapula, and the response will be contraction of the scapular muscles with the retraction and elevation of scapula. So this is called as scapular reflex. Now we are going to discuss about superficial abdominal reflex. This is a very important topic that you have to know. So what is the stimulus that you give? You give a light stroke or a scratch on the anterior abdominal wall. And what is the response? The response will be the umbilicus will be pulled towards the direction of the stimulus. So there will be contraction of the abdominal muscles, and that umbilicus will be pushed or pulled towards the side of the stimulus that you give. So that is what is called a superficial abdominal reflex. So the segmentation level at umbilicus is going to be T10, right? So there are two abdominal reflexes. One is involving the upper quadrant. So that is called a supraumbilical reflex, and that is mediated by the intercostal nerve, and the root value is T7 to T10. Now there is another lower quadrant which is the infraumbilical or suprapubic reflex, and the nerves that are mediating this are intercostal, iliohypogastric, and ilioinguinal nerves, and the root value will be T10 to the upper lumbar, that is L1 L2 level. So this is what is the supraumbilical and infraumbilical abdominal reflex. So essentially it is going to pull the umbilicus towards the side of the stimulus. There is one more thing that is called as Bechter's hypogastric reflex, where stroking on the skin on the inner surface of the thigh. So what happens is the contraction of the ipsilateral lower abdominal muscles. So this is what is called as Bechter's hypogastric reflex. Now there are certain situations where the superficial abdominal reflexes will be absent. So you need to know what are the common causes behind an absent superficial abdominal reflex. So it could be acute abdominal disorders, and this is called as Rosenbach sign, or in case of abdominal or bladder distension, or if the site of incision from an abdominal surgery or a posterolateral thoracotomy, if it is very adjacent to that, again the stimulus will not be produced, and a lax abdominal tone, as in an obese patient or a multiparous woman. So these are causes of absent superficial abdominal reflex, which is not essentially pathological, pathology related to the nervous system or the pyramidal tract. It is due to some other problem, and that we have discussed now. Now coming to cremasteric reflex. So in cremasteric reflex, you stroke the skin on the upper inner aspect of the thigh, and the response will be contraction of the cremaster leading to quick elevation of the ipsilateral testicle. And the nerve that is responsible is going to be L1, L2, that is the genitofemoral nerve and the ilioinguinal nerve. It is absent in elderly males, in patients with hydrocele, varicocele, torsion of testis and epididymitis. So this cremasteric reflex, it is absent in these situations, so you have to be aware of them. Now coming to plantar response, plantar reflex. So the plantar reflex, it's very important. I'll deal with plantar reflex and the Babinski sign in a separate video. But for completion sake, I'll tell you what the stimulus is and what the response you expect. So the stimulus actually is going to be stroking on the plantar surface of the foot from heel forward. And that is, you go above from heel towards the ball of the great toe. And the response will be plantar flexion of the foot and toes. And there is a pathology. If there is a pathology, it is called as Babinski sign, where you get the extensor plantar. That is called as Babinski sign. And the nerve that is mediating this is going to be the tibial nerve. So L4 to S2. So this is what is about the plantar reflex for now. And then now we will talk about superficial abdominal reflex. Superficial anal reflex. The superficial anal reflex is also known as the wink reflex, the anal wink reflex. So what is the stimulus? The stimulus will be stroking the skin or mucous membrane in the perianal region. So just around the anal, you have to visibly see the anal sphincter, and then you stroke just adjacent, around 2 centimeters away from the 1 to 2 centimeters away from the external anal sphincter. You stroke. And what you can see is the contraction of the sphincter. You can actually visibly see it. You can see the sphincter getting contracted. So the nerve is going to be the inferior hemorrhoidal nerve, is going to mediate this reflex. Root value will be between S2 to S5. So very similar reflex is the bulbocavernous reflex, where the stimulus you do is you pinch on the glans penis. You pinch on the glans penis, or if the patient is going to be catheterized, you tug, you give a gentle tug into the catheter. Just try to pull the catheter a little bit, and that response will be again contraction of the anal sphincter. So how can you best appreciate it? You put a gloved finger into the rectum and you squeeze the glans penis, and that time you can see the sphincter contracting and your finger getting gripped. So this is how the bulbocavernous reflex is examined actually. So why do we do it? What is it useful in? It is useful in assessing the integrity of the cauda equina, the lower sacral roots and the conus medullaris. So this is why it is very important. This is one of the reflexes which appears, which is one of the first reflexes to appear following spinal shock. So the first thing to reappear is actually going to be the bulbocavernous reflex. So it is very important. So with this, we have completed the discussion on the superficial reflexes, and in the next video I'll talk about exclusively about plantar response, that is our Babinski sign, and about Babinski sign. So in the next video we'll discuss about the plantar reflex and the Babinski sign. Thank you.